Well, it's a busy time of year for runners. There are several big races coming up.
Yeah.
Plus, if you're not doing a race, the weather is actually perfect right now for both long runs and even casual strolls outside.
But don't get sidelined because of an injury. Joining us now is Dr. Jorge Acevedo. He is a foot and ankle specialist with Southeast Orthopedic Specialists. Thank you so much for being here.
Thank you.
So let's dive into this and talk about some of the common injuries or issues that occur with the ankles and the feet, and we'll go from there.
Well, the wonderful thing about being a foot and ankle surgeon is I get to treat the whole age spectrum and all different kinds of injuries, all from kids with injuries they occur at schools to athletes with sports injuries and instability to the older population with arthritic conditions, deformities, bunions, whatnot.
So let's talk about a couple of things I know, like arthritis and ankle instability, and focus in on those. I mean, I've never heard of ankle instability before, so just kind of give me the 411 on what's that even about.
So ankle instability, if you're doing a sports or if you're at work and you turn your ankle, repetitive ankle injuries can lead to this. You're turning your ankle repetitively. And initially the treatment is anti-inflammatories, protection, elevation, etc. But 80% of these will get better with simple treatment, but 20% won't, and it'll lead to chronic instability, which can lead to arthritis. So for the instability, before it gets to the point where it's an arthritic condition, you can stabilize the ankle and repair the ligaments that are torn. And now we could do it through little small incisions with a little camera that goes into the joint and spare you of a big incision, basically.
So it's really important, if you notice this, then to come in and see a doctor immediately, because then you're warding off potentially getting arthritis down the road. So let's talk about arthritis, and I know a lot of people suffer from it because I have a lot of family members who suffer from arthritis. Talk about what the symptoms are, what people experience, and then also the treatment options, because I know there's two ways that you can go about it when it comes to treating arthritis.
Sure. So, people will come in with ankle pain, stiffness, and the classic sign is the theater sign. You're sitting here doing an interview and you go to get up and you feel that pain when you get up. So, and conservative treatment, again, anti-inflammatories, immobilization. We can also inject and do physical therapy. But when all those treatments fail, then there are two main options. And traditionally we did ankle fusions where you actually glue the joint together. The problem with that is that you're losing 80% of the motion. And if you look at this ankle for a second, you're going to lose 80% of up and down motion, dorsiflexion, plantar flexion. But now we have at our hands an ankle replacement option. And the nice thing about that is we replace the disease segments, which you can see right in there, with the components much the same as with a total knee replacement or a total hip replacement. And the technology today is fantastic. Now we use CAT scans to actually cater the cuts to each individual patient. So these implants are individualized to the patient itself.
That's cool. Hey, with a lot of folks coming up, like with the Gate River Run just ahead of us now, it's a very popular race. We've got a lot of athletes doing it, people that always train. We've even got some weekend warriors doing it, and maybe even some people that have been inactive up until now. What advice do you have for those who may be thinking about heading out to do the Gate River Run to kind of protect them from injuring themselves?
So, as we know, about 30 to 50% of people that run more than 25 miles a week are going to have an injury within a given year. So they're doing too much, too often, too soon, and they're not seeking advice, and it's too little, too late, if you will. So there are certain tips we can give them. Proper training, strengthening, and stretching is key, and there's a lot more to that as well.
And I think if somebody wants to come and see you, maybe they're getting ready to run one of these road races, or they're just spring right around the corner and people are getting out and they're being more active, if they're noticing the pain, what is the difference between a podiatrist and also a foot and ankle specialist? Because I know that people might have that question. And
sure.
What's the answer?
Foot and ankle specialists like myself, I went to medical school. Podiatrists go to podiatry school. So I'm the same as your family practitioner. I went to that same medical school. And then residency-wise, which is the years after medical school that we do, I did 6 years. So I did 5 years of general orthopedics where you treat all the musculoskeletal conditions, including hips, spines, and everything. And then I subspecialized into foot and ankle. whereas in podiatry, you're just doing the foot and ankle segment.
So one of the things that I often think about, because I'll go out on runs, I do bursts of physical activity, and then I'm inactive for a period of time, I always think that maybe this sort of pain or this little problem that I'm experiencing is going to go away. So when do you recommend that someone actually, call someone like you to be seen, to be treated, and perhaps to kind of explore that it could be something worse that I should have something done to?
Yes, if you've tried the simple stuff and the pain persists, there's swelling, redness, obviously open wounds, anything like that, you should definitely not delay and come see me.
All right. Well, thank you so much for being here. We appreciate
you.
And thanks so much to Southeast Orthopedic Specialists for sponsoring this segment. For more information, you can visit seortho.com, which is on your screen, and also 904-634-0640.